Okay, I get loading hand sanitizer, I get loading produce, eggs, whatever, baby food. Okay, I even get all that. But I saw one lady with 2 barbecue grills. Saw another guy with ice cream. Why you eating ice cream right now? Good day, everyone. Here's to containment. As the number of confirmed coronavirus cases reaches around 5,000 in the United States, I felt it only right as me as a healthcare worker give my point of view on how we're handling the situation and how we approach treating people who have this confirmed virus, even though it takes a really long time to get the results back. It takes about a week for us to even have an official confirmation that a patient has coronavirus. Honestly, what we're doing now is just treating everybody as if they have the virus. That's the safest option, and that's the best way to approach it. And we're kind of just riding China's coattails a little bit, just as to give an idea, because they've had about a few more weeks of experience in handling the virus than we have. So let's talk masks. So I remember about 3 weeks ago, one big topic of conversation that was on all the TV shows was people who are already wearing masks out in public. And they were kind of getting ostracized for it. I can't even lie. They had a bunch of people, a bunch of celebrity doctors offering their opinion. They had Dr. Oz on at one point, and they were showing them pictures of like celebrities and people who are out wearing their masks. And he was basically telling them, he was laughing at them, basically saying, "Oh, they don't know what they're doing. They don't even know how to wear the mask. This mask is not doing much." I just sat there and was like, okay, well, let's not believe that, and let's do what's best for your family, because it was so crazy. Why would you even say that? Well, now we know this was 3 weeks ago that he was saying that. Now everybody has a mask on because we found out that's one of the best ways to deter getting it in your eyes and your mouth. I've always said from the beginning, from day one, when the first cases started coming into the U.S., if it's a virus that can be entered through your nose, through your mouth, through your eyes, masks help. Even at a hospital where I work, they kind of said that, maybe we shouldn't wear a mask. This was 2 weeks ago. They were like, "Oh, well, we don't really need a mask. Technically, if you hold a piece of paper up to your face and you stand 6 feet away, you'll be okay." We didn't believe that. Come on now. Now today, they're basically saying we can't even leave the apartment without having a mask on. It's completely different. It's done like a 180 turnaround to where everything that was being said 3 weeks ago is completely different today, which is kind of the case when you get these novel viruses that people just don't know a lot about. Everyone's kind of playing it by ear, but we've kind of taken an American approach to it, saying, okay, well, let's start off more lackadaisical than having to be in an uproar and a panic, whereas a lot of other countries were in an uproar and panic about it. So to date, I think we're a little bit further than Italy was along. One big concern that we have regarding America as a culture, which is the biggest issue that we're having at the hospital, is the fact that we have so many civil liberties. They can suggest us quarantining, they can suggest us being at home, but it's up to yourself at the end of the day whether or not you decide to stay home or stay in one spot for the required amount of weeks to let this virus run its course. That being said, it's one of the great qualities about living here that, if you have family members at home who need you, sometimes you just got to sacrifice it. But it's going to be sacrificing that at the risk of infecting others, including your family members. So if you're an individual who starts to develop symptoms, you should definitely think about trying to quarantine yourself and adhering to the quarantine requirements. I know food is scarce now. Everyone's raided all the stores, so there's random items left, but you gotta get what you can get and just bunker down for a couple weeks. I'm off subject. Let's talk these masks. So as I previously stated, Dr. Oz was saying that, you guys didn't need masks and all this. I say if you can get your hands on some masks, no matter what type, for right now, get it. There are 3 main types of masks. They're based on various levels, one being the lowest amount that it can filter the smallest dust particles, 3 being the highest amount, meaning that it can filter out the smallest and most allergen and dust particles. And that's what we're going to delve into right now. These are one mask. As you can see, like humans, they come in all shapes and sizes, if you can see that. That one's kind of like a bluish color. I think I picked this one up at CVS back when they had them. This one's like a yellow, but it's the same level. It's kind of identical in how it's manufactured, but it's just a different color because it's different manufacturer. And this is kind of the cone shape. These are all level 1. You know, when you have a level 1 mask, because it doesn't have a terribly large amount of filtration, it's basically just a cover up so that loose spores and allergens don't enter your nose and mouth, but it has very loose elastic. It's more for comfortability more so than it is for protection. Also, what you want to make sure that all masks have, no matter which one you get, is some piece of metal, the longer the better, that can adhere to your face. That keeps particles from coming in at the superior part of your face and entering directly into your nose. So if you have a good mask that's thick with a good strip of metal going across the top that can adhere to your nose, then you're doing the best you can for the circumstance. Sort of like the mid-grade or the level 2, I guess you would say, are these masks here. This is from a brand called Hilliard. These are what you call surgical masks. These are masks that we wear in the operating room. I had this one for probably about a year now. These are kind of mid-grade filtration. They have a thin, if you can see, it's a piece of fabric in here that filters out a lot of particles, a lot of allergens that the level 1 mask don't. We use this a lot in the operating rooms when we're doing open body procedures, but it's still some comfortability. Like if you see these straps, you just tie them up. They're made of a soft fabric that are geared more towards being comfortable, because if you look at the side of the mouth, it doesn't really, this is also soft fabric. It doesn't adhere to the side of the mouth to keep all allergens out. We don't consider that as the highest level of protection that you can have. These two are what you would call N95 approved respirator mask. These give us the highest level of dust and smaller allergen particle protection. These are the best you can really get right now as far as protecting from the virus. It doesn't matter what brand. If you're shopping around for one, if you're fortunate enough to find some, the main thing you want to do is look for that approval. I don't know if you see that N95 on this one and N95 on this one. You want that N95 approval, meaning that it's been approved to filter out just about all particles. And when you picking a mask, you want to make sure it has a strong, tight, sturdy band to go behind your head. This one is like a elastic as well, kind of like the first cone one, but it's much stiffer, much more abrasive, and it's a much thicker mask. This one is what they call a duckbill. It's made for larger faces, which is what I commonly use. This is actually good. If you see that, it's more like a rubber, because I can clean it. That means if it can be clean, I can reuse that portion. If it can be clean, that's great, because I can reuse the mask more than once. So these masks I'll last a couple patients, because what I would usually do, put this mask on, then put another level 1 mask on over it to keep from saturating it. So if you have one of these masks and you haven't an N95 mask at all, you need to hang on to it. Keep it in a plastic bag after usage and let it dry, but don't seal the bag up. You want it to allow condensation to escape, but you want it to be as dry as possible when you use it. Also check the elastic. If the elastic isn't good and tight, then it's not right. It doesn't fit, so you need to throw it away. And my family kind of contacts me and checks on me a lot, just making sure that I'm okay, because they've heard the stories about healthcare workers getting infected with the virus, and I'd be remiss if I were to say that I wasn't concerned to an extent. So I try to take the necessary precautions to try to stay safe. Now, that being said, for the most part, healthcare workers who have been infected were direct care, which you would call a direct patient's nurse, or someone who deals with what you call aerosols. Aerosols basically mean that a patient has some type of breathing system. If you hear on the news, if you heard the president speak, they were talking about ventilators. So the people who do ventilation maintenance, which are your respiratory therapists, your anesthesiologists, your ED doctors, people who place tubes down patients' throats, and these tubes aren't screwed in. When they get ventilated, these tubes kind of fit snugly into a hole, and they come out all the time. Anytime the patient's jostled, anytime they're moved, these tubes come out. So when that happens, the patient starts to cough, and the coughing comes out of the tubes and basically sprays the entire room, and that's called an aerosol. It's coming now to a point where radiography is becoming one of the first lines of defense against diagnosing patients who have the coronavirus. It's just taking too long to wait on the CDC to return test results. It's taking 3, 4, 5 days to get results back, and that's just too long. Radiograph can be read in a couple hours, and we can also view progression or degression for the patient throughout their stay. So we play an integral role in diagnosing the disease. So we are around these patients a fair amount, and we do need to practice safe personal protection. They have a bunch of examples of what the coronavirus looks like on a radiograph, and some of them are really interesting to see, and I highly suggest you taking a look just so that you have a good idea of if you were to go in and wanted to view your own film. You couldn't view anyone else's, of course, but if you want to view your own, and you know what it looks like on a radiograph. So I'll put the description in the link below. Also, I'll try and post up a few pictures. But in the meantime, stay in contact with the World Health Organization. They have a lot of great information that you should be listening to that's updated as soon as they get it. So you really need to pay attention to that site more so than anything. They have a great description of they have a great diagram of things that you should be doing to try and stay as safe as possible. I'll post that as well. And it's basically what they call do the 5, which are basically 5 things that you can do to help keep the viruses at bay as long as possible. Those are things that take small effort, but they can be done and have tremendous effects on your safety as far as interacting this virus. So if you guys have any questions, feel free to contact me. I'm available all the time now. Comment below, subscribe for more information, and I'll get it to you as quickly as possible.